Hi, I'm Ann Buttrell, ADHA's CEO. I am pleased to share that ADHA is partnering with the ADA Health Policy Institute to monitor current employment conditions and track the impact of the COVID-19 pandemic on dental hygienists. Thank you to all the dental hygienists who volunteered to be part of this very important survey work. We will be hosting a webinar in the very near future to share the initial results of the survey. Please practice safely during this pandemic.
Hi, I'm Cindy Purdy, member of the ADHA Task Force on Returning to Work. Teledentistry can be a useful tool during this COVID-19 pandemic. Using teledentistry, the dental team can reduce the risk of exposure and assess the patient's dental condition to determine if they need to be treated in the dental setting. Additionally, teledentistry can minimize the overlap of patients and staff in the clinic, extending the dental hygiene hours in the morning or in the evening, allowing consultation with the dentist. Please practice safely during this pandemic.
Hi, I'm Kathy Eklund, member of the ADHA Task Force on Returning to Work. Many dental hygienists have been asked or instructed to extend the use of masks and respirators. CDC guidance states the extended use of face masks and respirators should only be undertaken when the facility is at contingency or crisis capacity and has reasonably implemented all applicable administrative and engineering controls. Such controls include canceling elective and non-urgent procedures and appointments for which PPE is typically used. Extended use of PPE is not intended to encourage dental facilities to practice at a normal patient volume during a PPE shortage, but only to be implemented in the short term when other controls have been exhausted. Please practice safely during the pandemic.
Hello, I'm Matt Crispine, ADHA's immediate past president. The CDC continues to recommend dental healthcare personnel consider if elective procedures, surgeries, and non-urgent outpatient visits should be postponed in certain circumstances. Provide dental treatment only after you've assessed the patient and considered both the risk to the patient of deferring care and the risk to dental healthcare providers and patients of healthcare-associated SARS-CoV-2 transmission. Please practice safely during this pandemic.
Hi, I'm Dr. Joanne Garenlian, Chair of the ADHA Task Force on Returning to Work. The CDC continues to recommend dental healthcare personnel avoid aerosol-generating procedures whenever possible. This includes the use of high-speed dental handpieces, air-water syringe, and ultrasonic scalers. Prioritize minimally invasive, atraumatic restorative techniques. ADHA further recommends dental hygienists use selective plaque and stain removal versus full mouth coronal motor polishing with a slow speed handpiece. Please practice safely during this pandemic.
Hi, I'm Vari Rust Clark, member of the ADHA Task Force on Returning to Work. Is your office using respirators as part of PPE? Before an employee can use a N95 respirator, they must have a medical evaluation by a qualified healthcare provider involving a specific questionnaire and evaluation, be fit tested, and receive training on respirators, including worksite specific training. Please practice safely during this pandemic.
Hi, I'm Katie Batani, member of the ADHA Task Force on Returning to Work. Dental offices should implement sick leave policies for dental healthcare personnel that are flexible, non-punitive, and consistent with public health guidance. As part of routine practice, dental healthcare personnel should be asked to regularly monitor themselves for fever and symptoms consistent with COVID-19. Dental healthcare personnel should be reminded to stay home when they are ill and should receive no penalties when needing to stay home when ill or under quarantine. If dental healthcare personnel suspect they have COVID-19, do not come to work. Please practice safely during this pandemic.
Hi, I'm Annette Moody Smith, member of the ADHA Task Force on Returning to Work. The CDC recommends appropriate PPE, including a surgical mask, gown, gloves, and eye protection. Remember, either goggles or a face shield that covers the front and sides of the face will protect us from procedures that generate splashing or spattering of blood or other bodily fluids and aerosols. Please practice safely during this pandemic.
Hi, I'm Lisa Morvek, President of ADHA. As COVID-19 cases and pandemic fatigue continue to grow, dental hygiene leadership has never been more important. ADHA is here to help you. I invite you to join us on January 15th and 16th for a Dental Hygiene Leadership Summit. Distinguished panelists will discuss leadership in your current practice setting, potential career pathways, diversity and inclusion in dental hygiene, advancing in education and association leadership, and more. You may register at www.adha.org. Please practice safely during this pandemic.